So our next patient today, Anne, probably has some other reasons for wanting to do laser resurfacing. The nurse has already put on anaesthetic cream on her face, so I know that probably will be doing a face. But what are your own concerns, Anne?
Well, I just feel I want to get rid of my lines and I'm not happy with them. I would also like to get rid of the red blood vessels in my face and my hands as well. So, and I also have these brown spots on my hands, which
okay, well, these hands should be actually quite good to do. It's interesting, a lot of people treat faces but tend to forget about hands, and hands are chronically exposed to ultraviolet, as we know, and this leads to differences in both intrinsic and extrinsic changes. And if we were, I suppose, to look at the skin model again just for a moment, extrinsic aging would involve chronic damage to the epidermis and the superficial dermis, and this is probably mostly done by chronic ultraviolet exposure, but there are some contributions by other things such as smoking. Do you smoke yourself, Anne, or you don't? Okay. Now, whenever we do get damage by photoaging to the skin, it leads to a couple of different things. I suppose the first thing we tend to get is epidermal and superficial dermal atrophy, and this leads to superficial wrinkling, roughening of texture, and also we get the appearances of what we see here, these sort of solar lentiginous, and maybe even actinic keratosis, which is a precancerous state, and obviously basal cell or squamous cell carcinomas. And I tend to do a full freckle check screen on anybody that I see with severe photoaging. The second thing that tends to happen, I suppose, a little further down is intrinsic aging. And intrinsic aging would involve atrophy of the deeper dermis, and also the fat tissue within it will become atrophied. And probably if we went down far enough, obviously the sort of muscle and the bone as well. Now, Anne isn't too bad here from the point of view that there's still, you know, quite a bit of muscle tissue within it, and the interossei muscles, when they become atrophied, certainly, you know, with older people, their hands can become quite markedly atrophic and aged looking. Now, we've had a number of therapeutic approaches over the years on how to deal with this. We all grew up, I suppose, with chemical peels, and from that then, of course, we used different lasers, maybe even some additives such as Sculptra Radiesse, derma rolling. And recently, as we became more used to using fractionized resurfacing, I found that fractionized resurfacing probably is a wonderful technique for this, because the first thing is that it doesn't take very long to do. The second thing is that you're not placing something abnormal within the patient. The third thing is you just got to be conscious of some things. It's going to take a little longer to heal. Don't run at very high densities. Treat it even kinder than we would the neck, because the thickness of the epidermis and dermis as we go down the body tends to get a little smaller, and there's no doubt about it that the hands, the thickness of the epidermis is almost down to 0.7 compared to 1.33 millimeters. So as a consequence, the skin has, you know, sort of thinned out quite significantly. We also can see, you know, sort of normally in skin whether there's substantial atrophy also of the skin secondary to collagen loss, and I don't get a good result here. Sometimes if I just get those lentiginous, I can actually just hit them with the fractionalized laser a couple of times over the one area, or maybe even switch off the fractionalized within it. Superficial veins will obviously be left behind, but this type of patient that has a lot of lines, it will be very satisfactory. Aging of the hands involves changes both in pigmentation, which we see here of course, wrinkling, which we can see here, and skin texture generally. And as we said before, this is a result of chronic ultraviolet and environmental exposure. Now, one of the advantages, I suppose, of CO2 resurfacing is that for the first time probably that we have a means to safely and effectively improve all these 3 parameters of photo aging at the one time. And this is a wonderful, sort of development from the point of view that if we use dermal rolling, we'll probably just get rid of the wrinkles, but we leave the lentiginous. And if we use some of the chemical ablation methods, such as one touch, which is high TCA content, we may get rid of some of the lentiginous, but will not effectively change the texture of the skin. So because this is doing 2 things, it's ablating and it's also forming collagen, then we can get rid of all 3 parameters at the one time, which is a wonderful advance, really. Whenever I'm doing hands, I tend to always run a density 2. Again, the square pattern I find is probably the easiest. The energy I run at 100, maybe even at 125 millijoules. And for some reason with rate, I always tend to run in hertz, whereas when I'm doing faces, I tend to run in watts. I think this is a hangover from the days when we were doing acne resurfacing, when you had to get up to 25 watts. But certainly, I know the swing more now is towards sort of rate. And I suppose the rate that I would tend to do would be 125, which I suppose is about 12.5 watts. And it gives me the advantage that the lentiginous, they're there first. I can almost do them and tend to get them out of the way. And then I can do everything else afterwards. Now, we know that as you get older, the dermis gets thinner. So a 21-year-old man will have a dermal thickness on the back of their hands, probably 1.25 millimeters. And a 7-year-old man, that will have dropped to 0.7. Whereas in the face, probably the average dermis would be in the region of probably about 1.375 up to 1.5 millimeters. And as a consequence of that, then obviously we need to treat the arms and the hands with some more laser respect. And you can see that whenever I'm going over the places where I've done the lentiginous, they take that little brown look almost of a double pass, but there's going to be a little bit of pressure and charring. The temperature we get to also is quite important, because collagen will tend to denature and remodel itself at different temperatures. 50 to 60 degrees centigrade will give a different effect certainly on collagen, thinking up into 70 or 80. At 1, it will begin to, the spiral molecule will begin to tighten. It's got a sort of a helical structure, particularly type 1 collagen A, that we tend to find in the backs of hands. Smart side dot by deta, and it has certainly the advantage of doing stacked pulses, and I like that. For some reason, eyes I tend to do in Dublin just with this other machine, which is the Luminex Active FX, and it doesn't tend to use stacked pulses, but for some reason I just like the double pass effect of it. Now, I also grew up on erbium yags, and we know with the erbium yags one of the big advantages that you just keep passing and it goes deeper and deeper, whereas with CO2, probably if you do 3 or 4 passes, it will not tend to go much deeper. It will go to a sort of set depth, unless you're using obviously the deep FX, but you will get more vaporization of tissue and potential problems of scarring. I think in any patient, if you've got prolonged erythema, particularly with any evidence of linear formation, consider the possibility of little hypertrophic scarring starting. We've only had probably one case of about 4,000 that I'm aware of, and that patient required dermatics, steroid creams. She was a slightly late diagnosis, because for a long time we thought it was a fungal infection, and I had her seen by some of my colleagues even in Italy, and they thought it was fungal infection also, but then we realized it was probably a little bit of scarring. Now, the fungal infection could have given rise to it, but normally then after that type of patient would need to be treated with a PDT laser, and probably also PDT in terms of photodynamic therapy, and they're healing fine now.